Hey, it's Rebecca Smith from the KBIA newsroom in Columbia, and it's time for Missouri Health Talks, a project where we listen in on Missourians' conversations about access to health care. For the month of October, we're focusing on the intersection of health care and artificial intelligence. Dr. Amy Patel is the medical director of the Breast Cancer Center at Liberty Hospital outside Kansas City. She spoke about an AI algorithm they use with breast ultrasounds that gives radiologists a data-informed second opinion. Here's Dr. Patel.
The way that we are utilizing it, and many practices and institutions who utilize this algorithm, how they're using it, is let's say that a patient comes in and they have a mammogram and they're maybe we see something. And let's say we call them back for additional testing. And we might do additional mammographic views and an ultrasound. And then on that ultrasound, we may see something there. And when we see something there, we can decide, do we want to use the AI algorithm or not? So you don't use it on every patient. It's just on select cases. So basically, the tool will analyze the lesion, and it analyzes the lesion in just seconds. So basically, it's a machine learning algorithm, and it's based on 2 million cases with both radiologic and pathologic correlation. It analyzes a lesion based on 17,000 features of interest. So it's pretty incredible. And basically, once you analyze the lesion, it essentially renders a risk assessment. Is this benign, probably benign? Is this something that maybe is suspicious and needs biopsy? So ultimately, it acts as a second opinion consult or clinical decision making. So at the end of the day, the radiologist has to make the call of what to do with the patient. So it's all a very secure network. There's no identifiable patient information that's going anywhere. But it is, these cases are being grouped with cases that are being used where other institutions and practices are using this tool now in over 65 countries. I mean, it's pretty incredible. This tool has been FDA approved, and so it's not some sort of experimental algorithm. Over time, we've seen improvement of just utilizing the tool more frequently. And I've never seen, knock on wood, I've never seen this algorithm undercall anything, like say that something benign and it was a cancer. I have seen overcalls or false positives, especially in the beginning when we were using the tool. But over time, with consistent use, I have significantly seen a drop off. So what we've been able to see now is we've been able to maintain our cancer detection rate, but reduce our unnecessary biopsies or false positives by almost 40%. So that's pretty significant. So we talk about patients and cancer care and detection and about, mortality. We want to reduce breast cancer deaths, but also we need to be thinking about morbidity. And morbidity of a patient happens when you introduce a needle in a patient's breast, and there's always a risk with that, whether it's infection, a blood collection called a hematoma. And so if we can also mitigate that as well, and just the cost of a biopsy, I mean, they're not cheap. Image-guided biopsies are very expensive. So if we can eliminate the cost for the patient as well, it's truly a win-win.
That was Dr. Amy Patel with Liberty Hospital, speaking about an AI tool they've added to their process to better serve their patients with breast cancer. That's it for this week's Missouri Health Talks. Tune in next week for more conversations from throughout the state about health and access. I'm Rebecca Smith. Thanks for listening.